In the heart of Eastern Province, Zambia, a quiet transformation is taking place. The Dambo Lathu project, spearheaded by Population Media Center Zambia, is transforming lives, one story at a time. Through the power of comic books, we are addressing one of the most pressing issues in our communities: early marriage and teenage pregnancies.
My name is Felicitas Moya. I'm the guidance teacher at Kapachi Primary School in Chadiza district. My thoughts on how the students are reacting to the project, they are reacting in a very positive way, in sense that they are now learning on the dangers of become a mother when she's young, or the badness of like getting STIs, because the Dambo Lathu project has been teaching the learners on the consequences when someone has STIs, or someone has pregnancy, or someone getting into early marriage.
The project focuses on girls aged between 10 and 19, helping them navigate the challenges they face in the areas of teen pregnancy and early marriage, and thereby giving them hope for a brighter future.
What I would like to see with the Dambo Lathu project is that they have to meeting the pupils frequently, like maybe twice, maybe 3 times in a week, so that at least they can learn more.
But Dambo Lathu doesn't stop with the young girls. The project is also reaching adults, parents, guardians, and community leaders.
Ine jina langa ndine Felix Dambo, ndine community health worker. Koma ine ndiri muno mukapachi mpo pa programu imene wa Dambo yathu imene banayibweresa ni programu yabwino kwambiri, chifukwa ni programu imene yatithandiza pamene yangofika tambophunzirapo zambiri zimene taona, zimene ife sitimadziwa. Ndipo chifukwa chophunzira kumeneku taona kuti chinthu chabwino kwambiri kumene bungwe ili litatilipitirize, ndiye kuti mavuto amene ife tilikumana nayo kuno kwathu yakhoza kuchepekera. Wanu tiliona kuti vana ang'ono atenga zimimba zimene mwina zosayembekezera, komanso zichokera mwina kwa zibambo akuluakulu. Chinthu chimene chili chovuta kwambiri, chimene mwina pamene maphunziro yabwera aya ife chatiphunzitsa kwambiri kuti tiphunzirepo, mpo tione kuti chimene chifunikira nchani ngati mwana wapezekani pathupi wamng'ono, komanso taone kuti wampasa pathupiyo ni munthu wamkulu, tiona kopita kumene ife tifunika kutani tipite kuti tione kuti mwana uja timthandiza bwanji.
Through engaging discussions and stories, we're shifting negative attitudes and behaviors towards teenage pregnancies and early marriages.
My name is Maybe Shamboko, Acting District Health Director in Chadiza District. I've been here since 5 years ago. When I looked at the implementing activities that we are doing, the indicators that have been troublesome, that include teenage pregnancies and also gender-based violences. And so we've been trying to put up interventions just to reduce these indicators because of the impact, the negative impact that they have on our community and our society. And so we've been struggling to put up different interventions. And now on board we have a new partner, Population Media Center, that is working with us to tackle these problems that we have in our district.
My name is Julius Samboko. I'm the Community Engagement Officer here in Chadiza District. Chadiza District have got 24 health facilities where we have community that need a lot of services. Dambo Lathu project has been very instrumental in the district. So far, it is being done in the 2 clinics, and that is the Chadiza Royal Center and Chamandala. So far, what has the project done in this phase is quite tremendous. We have seen a lot of people attending sessions for being organized by the project Dambo, Lathu, and the enthusiasm we see there is quite great.
The Zambian government, through the Ministries of Education and Health, has taken notice of the impact of the Dambo Lathu project and is working hand in hand with PMC Zambia to spread this life-saving message.
So this project definitely will help us to achieve our goals in terms of reducing problems affecting adolescents.
We wish that this project will actually scale up to all the facilities, because when you look at the responses from the facilities, the Chamandala and Urban, is quite good. So we hope that you to be scaled up to other facilities in our district, Chadiza.
Health professionals have also joined the cause, providing valuable information on sexual and reproductive health, family planning, and the dangers of early pregnancies.
My name is Mavis Manjanji. I'm a registered nurse at Chadiza Urban Clinic. I've been working there for 1 year, 8 months now. In my experience, when it comes to teenage pregnancy, SGBV, and STIs, in 3 months, we may have 120 adolescents who come for pregnancy related issues. Then STIs, we can even have about 500 cases that we come across as Chadiza Urban Clinic.
My name is Bridget Banda. I'm a facility in charge here at Chadiza RHC. This program, just from my experience, it is a very, very good program because it has actually helped so much to assist in terms of our teenagers or adolescents in our catchment area. Even if it hasn't gone too far, at least we are seeing changes in terms of the mindset with the community. You find that they are actually becoming aware of the dangers because of the comic shows that have been shown to them. They are actually abiding to certain things like avoiding early pregnancies, and then even school-going children. They are actually there talking about their experiences after watching the comic shows to say, I think it's better they concentrate on their education and then we are not concentrating on other things that can make them actually become pregnant. So that actually it's a very, very positive thing that we have seen, in that we look at our community in a different way because of the program.
My name is Taonga Banda. I'm a public health nurse here at Zemba Rural Health Center in Chadiza. Previously, because we had a concern with teenage pregnancy, Dambo Lathu has helped us to show the adolescents, not just verbally, but there are also comic shows that is helping us to show them what is happening around and how they can be helped in different aspects. And through the same comic shows, the attendance has been good. Children are eager to meet up with us on different sessions. So the project has really been helpful in that a lot of adolescents are realizing the importance of staying in schools and the importance of not going to marriages at a tender age. We have quite a number of adolescents that have realized that marriage is not a solution, but rather, even if they've gotten, because we've got a number of them that got pregnant but later realized saying, I can still need to go back to school. So relating to the stories of what they've watched on the videos, they saw it to have an impact to their lives.
This initiative, thoughtfully developed by Population Media Center Zambia, is part of the InnoverLab project, an innovative concept created by Population Media Center. Currently being piloted in Zambia, it holds the potential to be expanded across other PMC offices worldwide.
My name is Eric Chiombwe, Deputy Country Director for Population Media Center Zambia. The vision behind the Dambo Lathu project, or should I go into the InnoverLab project overall, is to see to the reduction of issues of early marriages in particular districts of Chadiza as well as Katete. Dambo Lathu project focuses on 4 key themes: early marriage, teenage pregnancy, HIV/AIDS, and sexual and gender-based violence. So the vision behind the project was to see how we could, as a project or as an organization, Population Media Center, contribute to the reduction of high numbers of incidences of cases around these core areas that I've talked about. At inception of the project, Population Media Center, just as any other projects when they're starting, did encounter some challenges. These were, I would say, programmatic as well as logistic. Programmatic challenges we faced included, initially we had scant information regarding the clear situation around the core areas that we talked about. National statistics do show high numbers, but we needed specific information, specific data relating to these 2 districts. So in the initial challenge we had was the issue of data, and how we went around that was we carried out formative research as an organization to come up with baseline data as well as formative data around the situation of teenage pregnancy as well as early marriages in the particular areas that I'm talking about.
My name is Miriam Banda Chisamba. I'm the facility in charge for Chiwolia Health Center, which is situated in Katete District, just along Mozambique Road as you're going to Chanida border. So my facility has got a total population of 35,731, and then 20% of those are adolescents, of which we do provide adolescent services at the facility, and we have a youth-friendly corner that the adolescent can access when they want to use the services whenever they come at the facility. So looking at the challenges that our adolescents are facing, we've seen that there is high number of teenage pregnancy, and also when we look at our geographical area, which is mostly rural, though we are peri-urban, we are looking at it that there is usually early marriages that are happening around, and then there's some cases of gender-based violence, as well as HIV and STIs.
I'm Tembo Abraham, the head teacher of Romomba Primary School. The way early pregnancy have affected our school, coupled with HIV, STI, is very, very sad, because you discover that a very young child who is still in the primary sector, a child who falls pregnant, and sometimes because of the cultural, you find a child, an innocent child, leaves the school and he goes and stays at home permanently. Because of lack of education, sometimes you discover that this child does not come back to school. But there is a policy of the entry policy. But unfortunately, you discover that some small girls are leaving school and they cannot come back to school, hence completely blocking their education. We are lucky that we received our colleagues, Population Media Center. When they came, they shared with us what they are doing, and they told us the major aim of the organization is to curb on early marriages and also help to reduce on STIs, then on HIV, including GBV. So far, so good. We are talking of more than 600 pupils who have been oriented. And because of this, we are seeing a positive change in our learners.
But the true success of this project lies in the students themselves.
Zina langa ndine Piri Catherine, in grade 11, Pazemba Day Secondary School. Ine natenga mimba ndi grade 10 term 1, chinazaka 17. Nakumana nazo zambiri, paliwe nangwenzo nilimbikisa kuti nipitize school, paliwe nangwenzo nibweza kumbuyo kuti saphunzire. Koma nangwenzo nilimbikisa kuti muntu watenga mimba sikutha kwa zonse. Apa nikamba pano ni grade 11. Mwana wanga na 11 months. Nimamsiya kunyumba ama nkhala, nimamnyosha ngakomboka. Programu ya Dambo Lathu inatiphunzitsa zambiri pomwe tamba video naonako za msikana tilele mwana enda uchikwata kali wamng'ono pe anatenga mimba napeza kuti anakanga kupapa wa mabonzenzi osakosa mwana anapitirira koma anaganizira abantu anamulimbikisa kuti abwereso ku skulu anabweraso skulu ero no pasa bwino na maksi abwino so nilimbikisa kwanzanga kuti munthu ngati wankhala na mimba sikuti nikusira kwa zonse awe ngawasebajapewa papa munthu ngabwereso ku skulu.
Students are now empowered to share what they've learned with their peers, becoming ambassadors for change.
As the project comes to an end in November, I would really not want them to stop or end the project, as the project has just run for just a short period, but we really want them to continue so that we reach out to other places that we haven't managed to reach out.
Chimene tipempha njakuti mwina bungweli lipitirire komanso kuti waonjezere zimene mwina ife tikhoza kuthandizika nazo zikomo kwambiri.
It's our prayer that the organization should continue to sensitize our pupils, because learning is a lifelong process. Sometimes today we teach them, tomorrow the information they forget. We would ask the population media to continue with this program in our school, as well as maybe expanding it to our fellow schools in the nearby schools.
My hopes for the Dambo Lathu project, I would really want for it to continue, because 3 months period, it's not a long period, because we haven't reached out to the masses. We've reached out to the pupils at Omelomumba School, and we've reached out to the community during the holidays, but we haven't reached out to many. So my hope is that we should reach out to all the masses in all corners of Katete district and in all corners of the catchment for Chiwolia, because if we reach out to all the corners, meaning it will have a very full impact, and we'll be able to see the change that we want in our adolescents.
What I would like to see with the Dambo Lathu project is to expand to more schools, like not just the Kapachi Primary, no, but they have to expand, go to more schools, educate the pupils there, yes, so that at least they can be aware of being pregnant at an early age, yes.
For us as a facility or as a Chadiza, including Chadiza community, we feel this program should continue, because when you look at the area that was actually catered for, it's a very small area, but the Chadiza catchment area is very, very big, whereby others haven't benefited to this program, in that we have a lot of girls out there who are still being married off young, others are actually getting pregnant whilst young, and even the new infections of HIV, we are still receiving them at the facility from these young girls. So these comic shows, if they can even be shown to other catchment area where this program wasn't there, I think it can help our catchment area very much.
The Dambo Lathu project is not just changing minds, it's saving futures. But we can do more. With your support, we can expand this project to more districts in Eastern Province and across Zambia.
My inspiration at individual level is to see development across Zambia. This is because living in extended families, we've seen the incidents or situations of family members which you wouldn't want to see perpetuating, the lives of different communities in the country. So my personal inspiration comes from the aspect of seeing development across the country, seeing children, reaching their full potential, seeing girls getting in school, girls getting educated and getting empowered. The Novella project is testing different methodologies of implementing development communication, development approaches, with the short scale of implementation time that we've had and the large impact that we've seen so far. It would indeed be a great opportunity for any donor or any interested individuals that want to see this development scaled up to other regions of Zambia to come on board The support that initiatives like this may receive may not necessarily be monetary all the time. It can also be in terms of technical support, resources, and I would say a lot of partnerships where different stakeholders bring different skills, bring different advantages that they have in implementing projects like this. There is room for a number of donors to come on board in order for us to scale up this project. This project has so far reached this high impact with minimal resources that PMC mobilized internally. Would really love to see a large-scale implementation of this project to other needy areas of the district, other needy areas of Zambia, through large-scale financial investment in the initiatives.
Support the Dambo Lathu project today and help us scale this initiative to reach more communities in need.